Hello, good afternoon, everyone. Welcome. My name's Ian Watkinson, and I'm a National Executive Member from the North West and also Chair of our National Health and Safety Organising Forum. And it's my pleasure to welcome everyone to this second session, Thinking of Becoming a Health and Safety Rep, as part of our National Health and Safety Month. Colleagues, lots of you watching will probably know that normally in November we'd be looking forward to meeting up for our annual 3-day health and safety advisor briefing, but for obvious reasons we can't. But thanks to the brilliant work of a team of national officers led by Sarah Lyons and the National Health and Safety Organising Forum, we've got a brilliant month and programme of health and safety webinars and training instead. I'm sure you'll all be well aware that since the start of the pandemic, we've recruited around 50,000 new members, including 2,500 this weekend actually, and around 10,000 new reps, including around 800 or so, might be more than that now, new health and safety reps. We're fortunate enough to have 3 of those new health and safety reps joining us today, who are hopefully going to explain a bit about themselves, their setting and their experiences as new health and safety reps that will help convince others to do the same thing. So rather than me read through the biographical details, I think it might be best if you guys introduce yourselves. So over to you, Debs.
Hi everyone, I'm Debs. I'm been a teacher of physics actually for about 26 years, all in West Sussex. So I'm a very loyal West Sussex member. I'm very proud that I'm currently at a secondary school called the Angwin School, and we're a county council school, so not an academy, which is something I think to celebrate. We're a really big school, so there's about 1,400 children, and obviously you can appreciate a lot of staff. So health and safety here is an issue completely across the board. We also have a specialist unit for children with physical disabilities. So that gives us extra issues to think about, because some of those children, for instance, those who are visually impaired can't do social distancing because they can't see the child in front of them. And we've also got children in wheelchairs and we have to protect them as well. So physics teacher, I've been teaching 26 years and still loving my job.
Thanks, Debs. That's good to hear. Claire.
Hi everyone, I'm Claire. I've been teaching for 10 years now. I teach biology and I'm also a head of year at a comprehensive secondary co-ed school, and it's also local authority rather than an academy. I'm new to being a health and safety rep. I signed up in late August because we didn't have a rep at all in our school, and some of the policies being sent out just didn't match with the science. So I felt that I needed to step up and do something, and it's been very interesting so far.
Fantastic. Well done. Thanks for that. Vicky?
Sorry, I lost you a minute ago. I'm Vicky Taylor-Bradbury. I'm a primary school teacher at Haslington in Cheshire. I've been teaching now for 20 years. I used to be an NEU rep many years ago. Our school hadn't had a health and safety rep. And I decided that with all that's going on with COVID, that we needed one, and asked everybody about it and volunteered to do it. I've just signed up this week.
Wow, that's proper new, but thanks very much, and you are very welcome. Moving on to Vik.
Yeah, thank you, Chair. Yeah, my name's Vik Chechi-Ribeiro. I'm a science teacher in a school in Manchester. I've been in the rep in my school for many years, but specifically around health and safety, that's something that started during the pandemic. So sort of attended the health and safety online training that was done over the summer. I already incorporated it into the organising that we've done in our school. So sort of looking forward to sort of expanding on that later.
Right, thanks, Vik, and thanks to all of you for your introductions. I think probably the way we'll do this is I'll ask a couple of questions and then give you guys the chance to answer, and then we'll do a couple more. And hopefully, as we run through, we'll get some questions from those that are joining us on the call as well. All right, so a couple of easy ones to start off with. What prompted you to become an NEU health and safety rep, and how did you feel about taking on the role? And a follow-up question, what has been helpful for you in carrying out your new role? So shall we start the other way around and start with Vik?
Yeah, thanks. So what prompted me to sort of take on sort of health and safety duties was the fact that in our school we didn't have a sort of specific health and safety rep, but sort of had myself being a workplace rep. And actually, when the pandemic hit, out of necessity, organising around health and safety was particularly important. And as we sort of move forward in terms of the situation at the moment, health and safety is increasingly important regarding getting members involved, active in the union, but also in terms of demanding a safe workplace. That's got to take a collective response at the workplace. So in terms of what has helped, the online training's been really helpful, but also sort of speaking to members and also sort of more general organising training. So at the moment, for example, in our school, we've got an open letter that members are signing, essentially calling for schools to close, as well as moving towards a rota system, which are sort of big two health and safety issues at the moment.
Okay, thanks. Thanks for that, Vic. Vicky.
I think the main thing that made me want to become health and safety, and as you said, I'm only new to it, was we're a primary school and there doesn't seem to be very much in place taking account for primary schools. It's all about secondary schools when you hear about wearing masks and that. And a lot of our staff are really worried about their safety when we've got 30 children in a very small classroom all day, no masks, no distancing, and no room to fit them in at a distance. So it was finding out how we can make things safe and approach our leadership to point out that our worries about whether we're safe or not.
Thanks for that, Vicky. Just to reassure you that we've got hundreds and hundreds of primary school health and safety reps, but great to see that you're doing your bit in your primary school as well. Claire.
Hi, I signed up to be a rep because over the summer we weren't getting a lot of information from our school. And as we're based in London, it's always been quite strict in terms of restrictions. And then the final straw was walking in on the first inset day and seeing the entire staff body sat side by side in a hall with no masks on. And as a biology specialist, I just stood at the back and was like, this is ridiculous. Contacted the head teacher and was told this is what should happen. And then having SLT come into my classroom to take masks from children who are wearing them to feel comfortable. So that was my last straw, to not only be the only workplace rep in the school, but to also do health and safety, because clearly we had a need for it. And the most helpful thing so far has been having a lot of contacts in the NEU. So I've done 3 separate training sessions to go over the logistics and the terminology and the information that you need, and then having someone there to ask questions to. It's really, really helped when I've then gone back to the head teacher to challenge a few things.
Thanks, Claire. That's brilliant. We know that many of us wear a couple of hats and might be workplace rep as well as health and safety rep, but that's good to know from yourself. Debs.
I wanted to be health and safety rep for ages, really. I was a whole school rep in my previous school. And when I moved across to Angmering, we already had quite an established reps team. So the opportunity to go sideways in some respects and be health and safety rep was there. And I started it being health and safety rep for about a year ago. So I started my training before COVID hit. So I was able to attend some of that face-to-face training, which was absolutely brilliant. And if you get the opportunity to do the face-to-face training, it's absolutely awesome. So taking on the role has been great. We've been able to talk about health and safety and get health and safety really on the agenda at school a little bit more. But it was able to establish those relationships with the head through health and safety and the premises manager before COVID hit. And that's been a really great thing and has helped us move forward in a really good way at school here.
Thanks, Debs. And yeah, you're absolutely right. The NEU face-to-face health and safety training is brilliant, and as is the online health and safety training that we've managed to put together and do so well with. So until we can meet face-to-face, then we'll need to run with that. Next question for everybody, and it's around challenges, and this might be something that people zooming in will be interested in. And what sort of challenges have you faced? And what's helped you overcome them, or what is helping you overcome them? And we'll go in a different random order now. We'll start with Claire this time.
So you probably guessed we've had quite a lot of issues in our school with our school being incredibly lax towards COVID. The main thing that's really helped is once the staff body knew that we had a rep and I sort of made it public that I was the rep, loads of people that weren't in the NEU signed up and everyone was really, really supportive. And once the SLT got a wind of the fact that most of the staff body were on side and had concerns, we started to see a lot of change before our meeting even took place. So that kind of solidarity between members was really, really important in making change happen before I even had to step in and have the meeting. So that's been really, really helpful. But just being able to ask those questions and feel sort of empowered, even though I'm new and I don't have all of the answers, I felt well prepared to go into the meeting with the head, which was rather long and hostile, and not the most pleasant experience, but we got the outcomes we wanted, and every point that I took in, we got the outcome we wanted. So it was really positive in the end.
Congratulations, you're overcoming lots of challenges there straight away. Vicky, obviously you're new to post, but you can perhaps tell us about the challenges that you might see lying ahead.
Well, as a school, we've been through a very turbulent 18 months, resulting in a sudden leaving of our head and a lot of staff that are very unsure and unprepared to tackle any of the SLT with questions for fear of what might happen to them. And the thought that I could be somebody that could take the worries to them when they're too frightened to at the moment, well, and help us to build our school back up. And develop a relationship with our new head, our new temporary executive head that's looking after us at the moment, and to make her realise that we do want to all work together and we want to make our school really good, but we want to be a really safe school as well. Okay,
thanks, Vicky. Sounds like you're starting with the best of intentions, with a bit of a plan there, and you certainly. I think the important thing for all of you is that you're not on your own, you're never on your own, and if you can build up a team around you, that can only help. Debs, challenges, how you're overcoming them?
I think probably one of the biggest challenges is actually to change the mindset of staff and actually get them to realise that actually health and safety is everybody's responsibility, and it's not just something that's responsibility of myself as the rep or as the premises team, and actually everybody has to take part in that. So if you need ventilation, you need to open your windows, and it's bits and pieces like that. And what we've done is we've made sure that the risk assessment, for instance, is being straightforward and easy for people to access. Because I think one of the challenges can be if you've got a very long risk assessment, people don't tend to read it. So we've tried to make it a little bit more user friendly so that the do's and don'ts are very, very clear to staff. And I think it's great being part of a really good reps team, because I found with our reps team, it's easy to bounce ideas off each other. And we've had really good relationship with the head. So he's been great at sending us things and say, what do you think about that? And we've been able to have a discussion about it. And that's, I think, one of the greatest challenges is getting people involved and people to realise that actually it's everybody's responsibility. But the easy way to overcome that is the fact that we've got a team and we can help each other out.
Thanks, Debs. Good that you've got a team there. We know that in lots of cases, people are working alone and they might be relying on the district and branch secretaries to support them. But if you can develop a team like you've managed to do, that's great. Vik?
Yeah, thank you. I think sort of one of the challenges that I've faced is really instilling the mindset into our members in the workplace and giving them the confidence, empowering them that actually on health and safety we can win, but the only way that we can win is to do it collectively, and really centering the participation of every worker in those actions on health and safety. So it's moving away from this idea that health and safety rep is someone who walks around a clipboard, does a bit of an audit and gives it to their teacher, but actually it's a continual conversation with the workers and the members in that workplace, and really thinking around what's acceptable, what demands can be won. So challenge of health and safety rep is it's about power in the workplace. Where does that power is? What's your membership density? Where's your engaged members? Mapping your workplace, and that's something that every health and safety rep should be doing. And then regularly meeting as members on health and safety, and being really clear on this and setting a negotiating cycle around health and safety, where as members we expect this to have a safe workplace. That could be things around having class sizes of 15, for example, and then saying really clearly to head teacher, if it's not met, then what's our capacity to escalate? So that's sort of things we're doing, you know, in our school, and what every health and safety rep should be doing as well in their workplace.
Thanks, Vik. Sounds absolutely brilliant there. You've all got loads going on, and you've hinted at this next question already, which is that what's gone well and what's going well, and how you being a health and safety rep has made a difference already, or is looking like it could make a difference. So it's about making a difference, what's going well. And we'll start with Vicky this time.
Obviously being, again, very new, so I've not had a chance to implement anything other than everyone knowing that they've got me to voice things that they're worried about voicing. Going well, we're actually getting in some kind of routines of our own, and we've decided as staff, even though we're not supposed to wear masks, we are going to, and the new head is happy for us to wear masks, because quite a few members of our staff are classed as being clinically vulnerable on the old last time lockdown, which obviously makes no difference, and we've got to be in school this time, but at least we know it's fine for us to wear our masks if we want to, and the new executive head is actually supporting that. So it's making people more confident to think, well, we can say something else if we're not happy about now, like everyone crowding into the hall at staff meeting, and having to stay and do PPA on site in a busy office, things like that.
Well, that's really positive about masks. Can I just check, is that wearing masks in the classroom?
We can wear them in the classroom. I have severe asthma, so I do, and some of my children, even though they're year 5, have started saying, can we wear masks? And they've been told, yes, if they want to, they can. They don't have to, but if they want to, they can. And I've got 14 out of the 30 that were wearing a mask yesterday through choice. So we're wearing them in corridors. We've got visors as well for in the class, and we're wearing them when all the parents meet us outside on the yard. So that's been a lot better for us, starting to make us feel more safe.
Thanks, Vicky. That's really positive, and obviously it fits with our national advice, and we've seen the DfE advice shifting a little bit. So that's really interesting, and sounds like it's going well, and you've done well collectivising around that issue. Debs?
I think we've had a really good input on the risk assessment, so that's gone really, really well. And I think we've really valued being actually part of that consultation. I think working with a head teacher that's a science teacher and very union friendly has been really good, and actually building that relationship with him has been a real proactive thing. I did a wellbeing survey in April, which I think got widely shared, and that was really useful. And in fact, if you've got the opportunity to use the union wellbeing survey, that's a really powerful thing actually to take that to the head and say, look, this is what people are feeling about this. It's not just me. This is the collective response from our members. We're not happy about this and we're not happy about that. I think the thing we've got going at the moment is webcams. And some people are happy to use webcams. Some people are not happy to use webcams. And it's actually making sure that people feel that if they don't want to use a webcam, that opportunity is there for them. They don't have to go with the flow. And I think as we've been bringing up the safeguarding issues of that in terms of health and safety, not just the physical, shall we wear a mask, not wear a mask. We've been talking about safeguarding of staff as well. So there's a lot of things that have been really useful. Having somebody that's definitely a health and safety rep on site.
Thanks, Debs. You've mentioned the stress risk assessments that all you guys have got access to, and that HQ will help you put together and produce a report if you feel you need to undertake one of those in a setting. And it's great that you've done that. I know that we've got some training related to work-related stress going on as part of Health and Safety Month. And it might be, if he's around, I'll ask our National Training Manager to come in at the end and just give us a summary about some of the other courses that we've got going on, John, just to signpost that. But for now, I'll go to Vik.
Yeah, thanks. So previous in health and safety, over the summer, we sort of got significant wins around those workers who are clinically vulnerable, being able to work from home. Workers that are high in risk, so for example, from certain backgrounds, are able to work from home as well. Going through into this year, so the NEU's joint risk assessment with other unions was used as a base starting point for our multi-academy trust. That was really successful. And I think sort of moving forward, what's worked really well is lots of what I said earlier in terms of really, members sort of taking ownership around health and safety. So our members meeting in schools, we sort of really push forward the idea that every department in our secondary school has an NEU champion, and they're the ones who come to that meeting. They listen to and they talk around health and safety, and then they go back to their departments and they share that what's been said and discussed with those members in there as well. And in order to do that, we've been quite successful in using health and safety motions as well. So we democratically discuss it. We amend it as you would in a district or in a branch, but we do it at school level as well. That's really been successful as well. But also, Debs mentioned around a survey. So we did a workload survey because we knew that was becoming an increasing issue. And we did that across our multi-academy trust, and that showed that 75% of any members in our MAT considered workload to have gone up. So we can then use that to the employer with like proper data in terms of a demand that actually needs to be taken on workload.
Thanks, Vic. And Claire, what's gone well? What's going well? I think you've covered some of this already, but just over it again.
The best thing that's come out of it really is that at the beginning, we had a risk assessment, which looked very nice on paper, the 48 pages that it was. But of course, when we came back to September, none of that seemed to have been executed. There was, as I said, no social distancing. Class sizes are up to about 32. No masks in corridors. It was pretty much business as usual with workload and expectation and health and safety. There was no acknowledgement. Once I kind of announced that I had volunteered for the role, 2 other people decided to volunteer with me, and we really got started. And then as we got our meeting set with the head, it seemed as if SLT had gone back and read said risk assessment and decided to actually do what was on it. And so there was an influx of emails in the week before the meeting of things being like, oh, by the way, we're now going to do our staff check-ins. So an SLT is going to check on each member of staff every couple of weeks to make sure their well-being is okay. And suddenly the parents' evenings that we were worried about were cancelled and moved to online, and masks were being worn, and the sanitizer, instead of being whatever strange budget version they bought, was actually a 70% alcohol hand sanitizer, which, and all of these things were in the risk assessment but weren't done originally. And so yeah, so that was really the good thing, is that through conversations that I had with various people, clearly from SLT and for others, it was kind of fed back to the head of, this is what the union are going to raise. So they tried to counteract it and get it sorted before the meeting. So we got a lot of wins, as I say, without actually having to go in. And then when we went into the meeting with our members' viewpoints, we were able to get wins on almost every front. Because a lot of the health and safety at the moment in the pandemic, it's quite straightforward common sense. And so things can't really be argued.
That's great, Claire. Yeah, I'm smiling now because I'm sure lots of people are wishing they could have the same experience that you've managed to achieve in your setting, where it all seems like it's common sense. So well done with all that. So final sort of question for this section, and this is the sort of pitch now. This is you pitching to all those people that are watching. And so what would you say? What would you say to any member who's thinking of taking on the role of health and safety rep, but they're still not sure? What would you say to them? And we'll start with Debs.
Absolutely, go for it, because I've realised I've been working at this school for 4 years, and I consider myself a fairly prominent member of staff, and one of my colleagues is watching, so she's probably nodding at the moment. But when I became health and safety rep, the agenda changed. And all of a sudden, what became, as Debs is moaning about something, Debs is now actually a legally protected health and safety rep. And you've got the huge amount of law, the protection of the law behind you. And I think I hadn't realised how much an impact that would have, because when I started complaining about a drip on something on the floor, all of a sudden notices started going up. And that was from the moment I became a health and safety rep. And we all thought it was a very odd coincidence that the moment we had a health and safety rep on school site, the agenda changed, and these little notices, health and safety notices, kept appearing around the school. And I think if you're thinking becoming a health and safety rep and you don't think it'll have an impact, you're really wrong, because it has an enormous impact, because you've got, as I said, you've got the wealth of the law behind you. And if they don't agree with you, and quite frankly, it's tough, because the law is there to protect you, and it's there to protect your members, and for very good reason.
Thanks, Debs. Thanks for that. That's excellent. Vicky,
again, being very new, it's quite hard because I'm just starting to get the hang of it now. But I've noticed straight away that the heads starting to think, starting to say, oh, well, we need to make sure we're doing that safely, and we're going to consider other things now that they weren't doing before. And I miraculously got an email from our chair of governors suggesting a health and safety group to work around school. And I thought, oh, that's unusual. I didn't even know she'd got my email address because I've not had anything from her before. So that was quite good. That hopefully just having a health and safety rep will mean things will happen, should happen. Like you said, things that are on our risk assessment will start to happen without having to bring it up. They might realise we're there, because I did get asked on Tuesday, I had to go into a meeting, I did get asked, why are we having a health and safety rep? We don't need one, by the head. And I thought people were happy. Explaining it's not that, it's about making sure that we all stay happy and all work together.
Thanks, Vicky. And safe. Yeah, thanks very much for that. Vik, what would you say? Any member who's thinking of taking on the role but still not sure?
Yeah, I think ultimately the big question is, where does power lie in the workplace? And that health and safety fits into that. And for me, power should lie with the workers in the workplace. It should lie with the union members in that space, and not with the employer who isn't teaching, for example, or a teaching assistant or support worker in a classroom for over 20 hours a week. So the best people in that workplace to know about health and safety, what that policy should be, is us. And being a health and safety rep is taking leadership and action in terms of bringing together what could be sort of individuals internalizing these issues, and you're collectivizing it, and you're actually doing something about it by sort of facilitating and sort of empowering others to actually win in the workplace. And ultimately it's about having democratic workplace, about democratizing the workplace, and health and safety rep is someone incredibly important in order to do that. And what's been really fulfilling for me is seeing the confidence of my colleagues who previously would sort of be scared to talk around their condition, their working conditions, and sort of feel they'd be labelled as being negative or against school. But actually, if you have an active, strong trade union branch, and a health and safety rep is really important in order to do that, you see visibly their confidence raise, and actually they start feel able to actually start there. Actually, we do deserve a safe workplace. And that seems like quite a simple thing to say, but we do deserve safe workplaces, and more than ever, because the issue for us having safe workplaces is also linked to the issue of safety in our communities as well. So it's never been more important to be a health and safety rep, to get organised in your workplace, because also, when we do win, and we will win safe workplace, now what else can we win on in terms of and workloads linked to health and safety, of course, but other things in terms of Ofsted, performance-related pay, and sort of the education system that we want. But it's got to start with having that organised workplace, grassroots, rank and file presence that a health and safety rep is incredibly important in developing.
Thanks, Vik. And that takes us on to Claire. Claire.
I really agree with the rest of the panelists. I think you've put it really, really well as to how important it is. We are legally covered. It is about the people on the ground doing the work. I would say sign up, because people will be incredibly grateful that you volunteered. I've had people that I don't know that well come and find me and say, thank you so much for volunteering. I feel so much better that you're going to be the one to stand up for us and take our viewpoint. So that's been really, really nice. Sort of echoing what Vik said, when they do things like health and safety walks and when they do risk assessments, it's a very small group of people making a lot of big decisions who quite often are not on the ground. And so members, especially from where I am, we always feel like things are just done to us and we don't see a lot of sense through them. So now that we have this rep in place, we do feel a lot more empowered to step up and say, that doesn't make sense, that doesn't work, this is not what we should be doing. We are in the middle of the pandemic, as we've said, so it's incredibly important. But more than that, teaching has always been an incredibly stressful career choice, and workload is always an issue. And I don't think we can underestimate mental health when decisions are being made by the head and the SLT with regard to our working lives. So definitely, if you're thinking about it, sign up, start the training. I've learned so much. It's been really eye-opening, even though I've been teaching quite a long time. I really have learned an awful lot, and these skills will travel with me wherever I go. So sign up.
Great stuff. You guys have all given such fantastic answers there. That how could anybody watching think twice? You've covered loads of ground with all those answers, and that's brilliant. Now, we have had a few questions pop up, quite a few about training. So if Jon Hegerty is around, I'm going to ask him to just come on now and join us and just perhaps say a little bit about the training that we've got lined up over this month, the training that we've been doing throughout the year, and perhaps plans for the future. Jon?
Hi Ian, thanks. Yeah, so there's been a lot of questions so far about the health and safety rep training. And as Ian and the other panelists have been saying, we do have a regular 4-day face-to-face training program for health and safety rep. In the current climate, face-to-face training isn't going to happen. So in place of that, what we've developed is a 3-part online rep training. And you'll see in the chat, we've posted the links to the booking for those courses. Before the summer, we ran dozens and dozens of courses and trained hundreds of health and safety reps. And if there are more people who want to do the course, we will put on more training. So the Becoming a Health and Safety Rep course is a 3-part course. Part 1 takes you through the role and the responsibilities and the rights of the rep. Part 2 takes you through looking at risk assessment. And part 3 takes you through looking at health and safety inspections. And by the end, certainly by the end of the 3 sessions, you'll be able to be a really effective health and safety rep. We've also developed a training course looking at issues around work-related stress and linking the health and safety role to work-related stress. So again, if you look in the chat, you'll see the booking, and if you just go onto the NEU website, and find the training section, the National Training Programme section. You'll see the courses listed. You can book those courses online. If they're full and we notice that they're full, then we'll start adding in more dates. And we try to be flexible about the dates. We try to put them during the day or in twilight sessions. The really important thing to remember is you have an absolute legal right to paid time off for trade union training. Your employer has a legal duty to release you on full pay to undertake trade union training. It doesn't matter how many members you've got. It doesn't matter whether you're a teacher or a support staff. If you are the health and safety rep, you have an absolute legal right to paid time off for trade union training. The courses are between 90 minutes and 2 hours long, so it doesn't take out a huge chunk of your day, but your employer cannot stop you from attending those courses.
Thanks, Jon. And that was something that I was going to ask our panelists about, but it's a really, really important point that, yes, you all have that entitlement for paid time off to attend training. That's for you guys now as reps. You'll probably, well, I'm sure you'll be aware of that already. And for those that are watching, perhaps a question that has come in is one about health and safety committees now. So I'll ask the question whether or not you have a health and safety committee in your school yet, or is that something that you've talked about? And I appreciate you might not, but I'll throw it over to you guys. So perhaps about training that you've managed to undertake yourselves and getting time off to attend that, whether there's been any problems, and also about committees. And we'll go to Claire first.
Hello. We don't have a committee because before I stepped up, we had nothing. But I learned about the committees when I did the training, and they sound really interesting. It's one of those 2 heads is better than 1 scenario, so it's better to have lots of input from different people. So now that there are 3 reps in our school, we have 2 more join me. We're really keen to get that up and running. I did the 3-part training that was just discussed by Jon with Monica and Lawson, and it was really, really helpful. And I would suggest that if anyone's signing up, that you definitely do that training. I know that everyone said that the face-to-face training is really, really good, but I can verify that the online training, the 3 sessions were really, really helpful and really prepared me. So
thanks for that, Claire. Vicky, not sure if, I know you're new to the role, but maybe it's something you've thought about already, along with training.
It's actually what I can answer. I'm booked on to the online training starting next Thursday. I purposely chose the Thursday because I have a TA on a Thursday. So when I went and asked for the time, I said, but it's all right because my TA can cover it. So you haven't got to worry about the cover, so I'll be fine. So I'd cut so that they hadn't got an excuse to say I couldn't. And there wasn't a problem there. So I'm starting that next week. And committee-wise, it's one of the things that the Chair of Governors wants us to set up. So we will be setting one of those up to include the cleaning staff and the dinner ladies as well, so that everybody's covered.
Okay, thanks, Vicky. That sounds like a good plan you've got in place there. Debs?
I've done a couple of days of face-to-face training, the first 2 days, and I've done the online training. So both are absolutely brilliant. If you do the face-to-face training, you end up with this beast of a manual like this, which you can take to the gym actually, and it saves you gym membership because it's very, very heavy. But it's really useful to do any of that training. And they equip you fantastically with lots and lots of documentation that you can back up to anything that you want to say. And it's fantastic to actually quote the Health and Safety at Work Act at your premises manager. If he hesitates of anything, you can just turn around and say, well, actually, according to Health and Safety at Work Act, we need to do this. And it's a really powerful tool to do the training. It's really good.
Thanks, Debs. I'm not sure we'll be able to dole those out to everybody. Yeah, huge change. Just drop that on the head teacher's desk or on his toes. Or
I will do. It's very heavy.
But obviously, all that information is available online and easily accessible. Vik?
Yeah, thanks. Yeah, in terms of training, get on. It's about upskilling yourself and able to sort of fulfill a very important and empowering role. So, you're entitled to it, and don't feel as if you're asking for permission from your head teacher and they're doing you a favour by granting you time off to essentially ensure that the workplace is safe. So if it is a no, then you need to demand it and go back to members and make that very clear as well. In terms of Health and Safety Committee, that's sort of what we're aspiring to sort of move towards, that sort of model, just with things as the way they are. Most of our meetings with SLT are dominated by health and safety anyway, so it's essentially become a de facto Health and Safety Committee on COVID and workload, which of course is a health and safety issue as well. But I think as important as a Health and Safety Committee is what you do with your ordinary members as well. What's incredibly important is that you have a cycle of at least half-termly members meetings where you come up, you meet, you come up with demands regarding health and safety, then you meet immediately with your head teacher afterwards, and then you sort of you list them, you get the outcomes that you need. And if those things aren't met, then the following members meeting always starts off with the minutes from that meeting with the head teacher, and then your members and yourself, you sort of go through whether it's acceptable, and then you sort of decide what you're going to do about it. So setting up a negotiating cycle with your head teacher, employer, and your members is as important as setting up a Health and Safety Committee.
Thanks for that, Vik, and thanks for that, all of you. Absolutely fantastic responses there, and some of your ideas and experiences, and anybody watching, I can't think they would have any doubt in becoming a health and safety rep. I would hope so. There's been most of the questions that we got on the chat and in the Q&A were around training. One of the questions was asking, in a small special school, can you still, with 90 children, only a few members, can you still have a health and safety rep? Well, I'm not going to put that to all the panel, but you absolutely certainly can. There's no minimum number of members for you to become the rep in that setting. Perhaps final question that I'll ask before we finish, and it might be that one of you wants to dive in on this one. And somebody has asked about, do you have to be voted in to become a health and safety rep? Is that something that should take place? Anybody want to wave and have a go at answering that question? You've perhaps been through that process already. Go on then, Vik. Your hand was up first.
Yeah, it should be a democratic process. It's a union. And I think in terms of framing it with your members, it's a case of arranging a members meeting and then putting yourself forward for it and then getting voted in. If it's not possible to meet, then you can send an email amongst your members to sort of see whether anyone objects to yourself being a health and safety rep, which is sort of unlikely to happen. And it might be someone else says, oh, I fancy to be a health and safety rep as well. And you end up sharing the role, and you use your initial interest as a means to building your union strength.
Thanks for that, Vik. And yeah, whatever works for you in your setting for all those people watching in. And if you're not sure how to make that work for you, then get in touch with your district secretary or your branch secretary or perhaps another rep in a neighbouring school. And I'm sure they'll help you with it, or contact us. I think that brings us to a close, but I think this has been a fantastic session. I hope that those watching and yourselves will join in with lots of the other sessions over our Health and Safety Month, and look forward to seeing you, if not soon face to face, then at some time in the future. Thanks very much to everybody.